again, welcome, and the floor is yours.
Thank you very much, Agnieszka. Yeah, welcome also from my side. Today I'd like to talk about teams in extreme environments. My team and I here in Zurich, we focus on team processes, or basically what makes teams effective. And most of our research is around teams in extreme environments, because we think that this is a wonderful setting to actually learn how the teams deal with crisis, and also more traditional teams can learn from these extreme environments. So today, in today's working environment, teams are omnipresent. Remarkable achievements of humankind, like developing the first computer, sending man to the moon, or even developing a vaccine for the COVID-19 virus in record time. These are all achievements that have been made by teams. I guess the time for this one Renaissance man that knows everything, can do everything, is over. So we need teams, interdisciplinary, interprofessional teams, to be innovative and to move forward also in all fields of work. So it makes sense to learn also from these teams that deal with crisis on a daily basis. So what I said before, teams in extreme environments. So these teams, they are often very specialized, and they work well usually. And I think we can learn a lot from these settings. And in the next 30 minutes, I would like to take you on a journey about the so-called extreme teams. And I want to show you some results from 4 studies that we did in different fields. And also want to maybe highlight a few processes or outcomes of these teams. And I hope that you maybe can take 1 or 2 things also and translate it to your own team, because I usually think that what works well under pressure and high stress should also be beneficial in less extreme conditions. So let's start first with the definition. What is an extreme team, or what does that mean, extreme environment? And we published a theoretical framework that helps categorizing teams in extreme environments. Generally, we argue that teams are extreme if they regularly face extreme events. And extreme events are defined as discrete episodes or occurrences that may result in an extensive, intolerable magnitude of physical, psychological, or material consequences. And to further categorize these teams, we came up with this framework that defines the environment either as task extreme or environmental extremeness. And when we talk about environmental extremeness, we think about the external context, the physical environment where a team is working. And this environment is usually can be hostile or threatful. This can be the deep sea, a desert, or Antarctica, where you sometimes even need some equipment to even survive. So this extreme environment is a constant threat somehow that is lurking for these teams. Then on the other side, the context can also have this task extremeness, which is basically that the extremeness is tied to what the teams actually do, and basically the outcomes or the consequences. Let's imagine a medical emergency team. So if an emergency team doesn't work well, maybe a patient will die or a patient will get harmed. So here the extremeness comes really from the task itself, and this can have consequences. Now, this framework, we came up with this with the idea that it's not either extreme or not extreme. It's more like a continuum where teams can be placed on this extremeness continuum. And I'd like to highlight this with a simple example. And here a picture of a window cleaning team. Arguably not very extreme. So they clean some windows. Maybe the man on the right is a bit in danger with the ladder, but nothing too crazy. However, we can increase this environmental extremeness with the same task. Here, as you can see, still a window cleaning team, but now the environment is a bit different and probably a bit more extreme. The task in itself, cleaning a window, is still not very extreme. And if they fail to clean the window well, that doesn't have very strong consequences. But the environment they're hanging from a building is extreme. So that's the basic idea. And depending on where a team is working on, how the task is characterized, we can place these teams on different spots in this framework. So I already mentioned an emergency team in a hospital, right? So the team in itself, the environment, the hospital is usually safe, but the task in itself, saving a patient, is probably quite extreme because of the high stakes outcome. On the top left, another example would also be a science team in Antarctica. So they are in this environment, harsh environment, very cold. You need some special gear to get out. And of course, this science team in Antarctica, if they are working on a task that is maybe a bit more critical, then they can definitely move also with task extremeness in a more extreme sector here. An example for very high extremeness where the environment as well as the task might be extreme here could be a combat medics in a war zone. So if a team or emergency team in the same way is in a war zone, rescuing soldiers, at the same time there is this environment and threat from the outside. So here we have basically both sides that are very extreme, and these teams have to deal with very strong extremeness. And two things that make, or why is this relevant, right? So what happens when an environment is extreme? So two things. One is probably stress. The more extreme an environment is, the more likely it is that a team experiences some stress. And we all know that stress has a lot of negative impacts on us. So the rational thinking maybe decreases a little bit. We get this tunnel vision. Maybe communication in the team is not as good as in a low stress environment. So that makes working together difficult. But also there is something that's called high situational pressure. So in a high extremeness environment, it is very clear what to do. And one characteristic of these high pressure situations is that individual, for example, personality predictors, they almost have no impact on motivation, for example, or what people do. So a simple example, in an organization, there is an accountant, and this accountant might have some issues, might not be very motivated depending on his or her personality. And there are multiple ways how he or she can do the work. So arguably in this traditional setting, there is not much pressure from the outside, except there is a boss that is like very punishing. But if you are in an extreme situation, in a life or death situation, if you're under threat, you just run. There is no questions. There is no motivational issue. Should I now run from this threat? The pressure is there, and there is very clear ways how to do what to do. So that's also a characteristic of these extreme environments. So now let's start with the first study. I would like to start in the high task extremeness sector and present you two studies from actually medical emergency teams. And here in the first study, we investigated emergency teams and actually looked at their inaction team reflexivity. And inaction team reflexivity is when teams during a process have a very quick timeout. For example, like a reassessment. Okay, what's going on here? Are we on the right track? Did we miss something? And this might be a bit counterintuitive, but in these high pressure situations, it's actually very beneficial for these teams, according to our studies, to actually slow down a little bit and go on this higher level and do this quick reflective timeout, or however you call it. And we wanted to see how this impacts basically performance. So we had the setting, it's a medical simulator. Here you can see this simulated patient is a mannequin. It's a high-tech simulator, so they can perform very complex tasks with this simulator. You can simulate cardiac arrest. You see the chest going up and down. There's a microphone in this mannequin. The baby can cry or not, and they use their real equipment and real medication. So it's a very real way of simulating these emergencies. So in our study, we had 70 teams, and they went through several scenarios where they did some emergencies, and we had some experts rating the performance, and we used behavioral observation to actually code if the teams showed this inaction team reflexivity, or if they just did the scenario without actually reflecting much. Here, just a few examples so that you can imagine what is this inaction team reflexivity. These are expressions like, can we quickly recap what's going on here? I'm not sure what the cause is here, any ideas? So this inviting input, and can we quickly summarize? We did X, Y, what are our next steps? These would be examples of inaction team reflexivity. So always when the team basically steps back a little bit from the task at hand and goes on a higher level to actually process information. And as expected, we saw a positive relationship between inaction team reflexivity and clinical performance. So teams who showed more inaction team reflexivity, they usually also performed better. Although this inaction team reflexivity might take a little time during the process, it is still beneficial because they're more effective, they plan more, and it's less likely that they run into a wrong direction, because we know under stress you have this tunnel vision, and then going actually out, reflecting helps regroup the team, and then having a shared goal and being more effective. We also looked at a moderator, which was team size actually, and we saw that this effect is even stronger for large teams. So as you can see, the triangle line here, we have these large teams that if they don't show inaction team reflexivity, they're actually worse than small teams. But if they actually do reflect during the process, then they are better than medium and small teams. And we explain this simply because in a large team, it's even more difficult to coordinate actions. In a small teams, you might see what your colleague is doing, but in a larger teams, like 5, 6, 7 people, it's harder. And then you need these moments when you kind of reassess, regroup, and through this inaction team reflexivity, you are able to actually activate the additional resources that you have in a large team. So from this study, we then conducted the next study and looked at team reflexivity, not in the action, but more in a form of debriefings. So that's another form of reflecting. So after a case, you get together and you reflect about a previous work experience. And from the literature, we know that teams who debrief, they show a better performance. What we don't know is what are actually the mechanisms between this effect, and also most of the literature is looking at the effect from debriefings on performance and not so much on well-being. So we wanted to see what is actually the effect of debriefings on well-being, and in our case, emotional exhaustion. So we had a simple hypothesis, a positive effect between debriefings and emotional exhaustion. And we argued that this effect is mediated by speaking up behavior. Speaking up behavior means that you actually address things that you don't agree with, you bring up new ideas. Speaking up is a really proactive behavior that is very beneficial in work teams, because you want your team members actually to give you information and to tell you in the worst case if you do something wrong. And why is this the case? So we argue that if you participate in a debriefing, that increases your resources. So we have a basic need at the workplace. We have a need for autonomy, relatedness, and we want to perform well. And participating in these debriefings, having the opportunity to reflect, is actually addressing these needs. So I talk about the past experience that results in learning. I can learn new things. Then I also have more interactions with my colleagues, which increases probably the feeling of relatedness. I feel more as a team. And also the feeling of autonomy. When I participate in a debriefing, I can then also show speaking up and then maybe feel better to change things in my work environment, which results in increased autonomy. And this all things increase my resources. And we know that if I have more resources, I can then deal better with demands in the workplace, stress and everything. So I should be better able to deal with these things and feel less emotional exhaustion. And speaking up in between, speaking up can be seen as a resource investment. So sometimes speaking up, saying something in the team that can be uncomfortable. And in the same way, through these debriefings, I feel encouraged, and then I would speak up more. And after that investment, I also feel better. And this again increases resources, which should help me deal with emotional exhaustion. We have also a moderator in there, so debriefing valence. So we looked at the tone of the debriefing. So is it more talking always about the negative things, or is it more like a constructive discussion, a solution-focused discussion? Because we felt that if you have a debriefing, but you still just talk about all the negative things or even blaming people, then it might be less effective. We had 2 samples. It was a survey study with 3 measurements. Sample 1 was a public hospital in Switzerland, and then we tried to replicate the same model with a second sample from a medical emergency conference, where we got 585 respondents from all over Germany, Austria, and Switzerland. I don't want to go into too much detail of the survey, but 2 things very important. So the debriefing, since this is on an individual level, we simply asked, how often did you participate in a debriefing in the last 4 weeks? That was our predictor. And we assumed that if I participated in more, then I should have these positive effects. And debriefing valence was just a subjective rating where we asked people how much time of your debriefing did you spend talking about negative versus positive aspects from 0 to 100. We could confirm our hypotheses. So there was a negative effect. So the more debriefings I attended, then the less emotional exhaustion I felt 2 months later. And the same with the mediation. With debriefing valence, also this was a positive moderation, and it was quite interesting to look at this, because here, as expected, if you have a debriefing that is perceived as more positive, as more constructive, then you indeed have this positive relationship. But if you have a debriefing that is perceived as more negative, as more problem-focused, here the red line, then actually having a lot of debriefing is detrimental and can actually decrease your speaking up behavior in the model, exactly the opposite. So that was one of the first studies where also looking at the quality within what is happening within a debriefing that hasn't been done before. So until now, this debriefing was always this black box. And this shows us that, maybe it makes sense also to look a little bit about the content of these debriefings. So now I'd like to move up to more environmental extreme teams. So negative emotions like emotional exhaustion are obviously also relevant in these settings, and especially if you are in an environment that is very threatful, like Antarctica. Here an example where a scientist actually stabbed his colleague because he told him the ending of a book. So that's just one example that in these environments, because you are confined, you don't have private time, you're forced to interact. So these emotions are important, and we need to see how we can manage these emotions in these teams. And therefore, we did a study actually with two sub-studies. So the goal of the first study was what type of events actually trigger extreme emotions in Antarctica teams. And the second one were about the strategies. So how can a team cope or help each other managing these extreme emotions? So for the first part, we did an interview study with 8 researchers that went to Antarctica, quite some experience, from 1 to even 8 summer campaigns, 6 female, 2 females, 6 males. So these were classical scientists that we interviewed, and we really asked them about situations where they had experienced very extreme positive or negative emotions. And from the background, we used affective event theory, which is from work in organizational psychology, basically says that if you experience positive events, this leads to positive effect and satisfaction, and then better performance. And the other way with negative events, negative effect and lower satisfaction. And we wanted to see how does that look like in these Antarctica teams, and we came up with 3 themes, overarching themes. So we have hassles that then lead to negative effect. And on the other side, we have uplifts that then lead to positive emotions and better performance. And with the hassles, we saw that a lot of friction is coming from social interactions. So on one side, missing family at home, or even having conflicts in the team. These are examples for social hassles. Then there are the physical part. Because of the environment, it can be very hard going out into the cold, geologists getting some samples, walking a lot. So these are physical hassles that then lead to negative emotions. And then there is the environment in itself. So weather changes, bad weather, or sometimes people are stuck at the station, they cannot go out. So because the weather changes so quickly, this then leads to change of plans, or maybe leads that they cannot reach their mission goals. So these are examples that then lead to negative emotions. On the other side, we have social uplifts, campaign-related uplifts, and eco-psychological uplifts. So social uplifts, of course, as the hassles, also social interactions can be very positive. So we heard a lot of positive events where people were interacting, joking, experiencing support from others, which then led to really positive emotional states. Campaign-related uplifts, basically everything goes well, I reach my goals, I can find my samples. Because these people are usually very, very committed to their cause, this can lead to very positive emotions when they can reach their goals. And the third one that we also heard over and over again is this impact of the environment, this eco-psychological effect. So the nice weather, or flying into Antarctica for the first time and seeing the nature that gives them some kind of awe that we heard all the time, and puts them in a really positive state. And that's, I think, something very unique to this environment. Overall, the model, that's how it would look like. So you have the uplifts that lead to positive effect, and the hassles, negative effect, satisfaction, and then to campaign performance. And the idea is, if you know about these hassles and uplifts, then you might be able, as a manager, as a leader, or even as a team, to influence these and be aware of these, and proactively do something. And that was actually the goal of the second study, which was a case study where we had one team for a 2-week mission, and they responded to a survey 3 times a day. So the PANAS, positive affect, negative affect scale, the two researchers 3 times a day responded to the PANAS, which gave us a very quite detailed information about how positive and negative affect developed over this 2-week period. From there, we added more like a collaborative autoethnography approach, which means we also asked them to do journals. So we had very detailed journals from every day. So we had a very detailed description of the 2 weeks, what happened. And we looked at the PANAS ratings and picked the 25% most positive days and 25% most negative days, went to the journals, so looked what happened there, and then we conducted interviews with them and talked about what this situation, what happened there, what did they do, and especially how they dealt with it in order to come up with some emotional regulation strategies. So first, what was very interesting is that here you can see the results from the 2 researchers, and just by looking at it, it's incredibly similar. So when one goes up, the other one also goes up, and they responded to the survey independently from each other. So they were not sitting next to each other. Hey, what do you have here? What do we have here? They really independently on their phones responded to the survey, and still we have this very high correlation on a day-by-day basis. Of course, it's not perfect, but still that shows that they work very closely together. And in psychology, you might notice there is this notion of emotional contagion, right? When I feel something, my team members, this spills or crossovers to other people. So if I am in a bad mood, this is somehow contagious. This is one mechanism, and the other, of course, is that these two, they worked on the same projects, and if something in the project didn't go well, it at the same time impacted both people. So that's the other explanation. So we cannot fully rule out what it is, but I think still looking at this, it's very interesting that these swings of mood, they almost are synchronous for the 2 researchers. So in terms of strategies, what we learned from the interviews and reflecting with them, we could define 5 strategies, what to do actually to regulate these emotions. And one that we heard is praise, just giving compliments, which can be a powerful strategy to increase motivation in a team. Just things like, hey, well done, you did a good job. I think that's something we don't do enough, but can be very powerful in a team. The second one is cognitive reframing, which means that you basically, in the stress therapy, you do exactly the same thing, so that you work on this appraisal effect. Instead of seeing something as a threat, you see it as a challenge, for example, and highlight the positive things. And we saw some very nice example where this has been done in a team. So some team member was down and the other one was, oh no, let's look at this as a learning thing and tomorrow we do it better. And so they together through discussions were able to reframe these challenges and change the negative emotions. Planning for routine and private time. I think that's very specific also for Antarctica, because you don't have much private time. And one strategy that this team did is usually in the mornings, they always reserved like 2-3 hours for themselves where they did not work together. And they knew, okay, this is my time and we don't have to do something, which helped them to recover a little bit from the stress that was going on during the day. And having a routine is also reducing uncertainty. And I think that's also a very powerful strategy, if that's possible. And of course, maybe there are some teams that need to be flexible depending on weather or whatever in Antarctica. But planning for routines and private time, I think, can be a good strategy to avoid negative emotion and stress. Backup behavior. That's something that we also know from the team literature. It's very powerful if I can relate, if I can rely on my team members. I know they're there. One of the most important strategies in teams and impacting team performance. And here a quote that we got from the interviews. I clearly could see that he was really stressed, and I could feel that. I said, okay, don't worry. I will work on XY as you do your thing. It was very clear that I will just move on with what I can do now and give him time and resources. So there was something that impacted one team member, and the other one said, hey, do your thing. I will move on with the project. And this can be very powerful and helpful in teams. And the last will finally playfulness. So we saw a lot of playful moments in these Antarctica teams on the stations, using humor, spontaneity. So this quality of being lighthearted really helps to diffuse situations. And on these stations, usually you also have like a table tennis table, or there's maybe a gym where you can play games. And even playing games is very powerful, because on one side it distracts you from everyday life, and on the other side you interact with others, and it also changes the hierarchies in a team. So, for example, if you have the supervisor with his PhD student, and then the supervisor obviously is the leader. But then if they play soccer, maybe the PhD student now is the leader because he's much better as the supervisor. And you have completely different dynamics, and you get to know each other from a different side. And this can increase again the team interactions and improve teams and reduce this stress and negative effect. So the last study that I like to show you here. So we now talked about the summer campaigns, which are usually shorter and arguably not super extreme. Still Antarctica, but in summer Antarctica is very populated. You can go back and forth. So this study, a collaboration with the European Space Agency, we looked at a team that was a winter over team in Antarctica on a 10-month mission. And here the Concordia station is really super isolated. So in these 10 months, in the first two and the last two, you can still go back and forth, but then it's not possible anymore. So they're completely isolated. And here we had, on one side, we wanted to know how team dynamics change over time, and we want to see how investigate the use of wearable sensors, and then create social networks as a monitoring tool for these teams. So as I said, we had a winter over crew, Concordia station, with 12 people, 6 from Italy, 5 from France, and 1 from another country. And we used on one side questionnaire where we assessed different constructs, and we had social networks like proximity sensor, as you can see here. They use radio signals, and they track the proximity to all other sensors, like on a second-by-second basis. So that allows you then to calculate these social proximity networks. So in terms of team dynamics, so first we measured paranoid thoughts and feeling of loneliness, and we saw a slight increase of loneliness, obviously, which makes sense, and also actually an increase, especially from month 3 to 6, of paranoid thoughts. So that means that people felt more that other people are hostile, and also that other people want to do them harm. So really a psychological process that apparently increased. It doesn't look very dramatic here, but still it is a significant increase, and can basically then lead to psychological disorder if this is too extreme. Then we saw increase of conflicts. So here very strong, especially from month 3 to 6 and 7. They had much more conflicts on the crew, and the feeling of team cohesion also dropped steadily over time, and their perception of performance as well. So they felt they're less productive from month to month. Now looking at the social networks, here you can see the aggregated contact measures from these proximity sensors. We always had 2 weeks periods where they were wearing the sensor in the 1st, 3rd, 6th, and 9th month. And basically what you see, like the thick lines, means that someone interacted more with this person or also this environment. So the top right, we also had sensors in the lounge, the gym, the video room, cafeteria. And on the bottom, you see the Italian group. On the left, there is the French group. And the A, that was the medical doctor. And the bigger the circle is, then the more interaction this person had, and the bigger the line, then the more this person was interacting with this room or person. What we can see, what jumps out is in month 3, for example, person N spent a lot of time in the lounge, but then in month 6, not anymore. And then month 9 again. So the lounge seemed to be like a hub also for other people, where people met. So the medical doctor, month 3 didn't spend any time actually in the lounge, but then month 6 and 9, a lot of time. And also this allowed us to look at the interactions between different groups. And because we had a French group and an Italian group, we can assume that this probably might lead to some subgroup forming, and that is exactly what happened. So here you can see the contact measures between national groups, so Italian and French. So overall, there was an increase of interactions within your group, so Italian with Italian, but also cross-nationality until group month 6. And then in month 9, you see 3.78 versus 0.97. That means they mainly interacted within their own national group and not so much with the others anymore, which was also reflected in the survey with the conflict between these groups, unfortunately. So yes, so the overall goal of this project was, or maybe for the future still is, to use this sensor as monitoring systems. We also tried to find some correlations between sensor data and the survey data, which was a bit inconsistent. We found some relationships, but not others. But also we have a very small sample size of 12 people, so we need to gather more data so that we can really have a quantitative analysis between sensor data and subjective survey data. And hopefully in the future, maybe also for astronaut teams, use this approach, use these social networks as predictive models to predict things, for example, like team cohesion. On here, subgroup forming, when you see like, oh, these groups are always outside the others, careful, we should maybe have an intervention or something. Good, so I have not yet talked about the high, which is, you might be asking, what is there? I have a case study that I very quickly want to talk about. It's at the same time a research project, but also a project where I'm personally involved. And this is a project with a team. It's called 44 West. It's actually a team of 4 athletes, rowers, and in December they will participate in the world's toughest row, which is a race from Spain to South America, and they will row over the Atlantic, basically. And I think that can be considered as high task extreme. They have to row. It's very physically demanding. They almost don't sleep. But also the environment, obviously, the sea can be very rough with storms and wind and even animals. Last year, there was a swordfish attack that attacked the boat, actually. So this can, yeah, definitely an extreme environment. And what I do with these for athletes is, on one side, we have a study that we are investigating how sleep and this physical decrease basically influences their mood and also the team dynamics, because the sleep is a very interesting thing here. So you see on the picture here on the right, they have a little room in the front and the back, and what they do is they sleep in like 3 hours periods. So always 3 hours rowing, 3 hours sleep for one whole month. And yeah, you can imagine that this will probably have some impact on their psychology as well as their physiology. And actually right now they are in the Mediterranean Sea. They have a test row where they row from Genoa towards Sicily. Today they arrived in Sicily. I got some update, and now they will row back to Sardinia and Corse and then back to Nice on Saturday. And I already look forward to hear from them. So we gather the sleep data and some mood data and test and see what we can do then and prepare them also for the race in December. And here that's also, I think, an example how we can learn from other teams, and like 4 strategies that I implement and worked with them is some communication strategies. So in medicine, there is a concept called closed loop communication, or also in military, so that you very explicitly repeat, hey, can I have 2 milligrams of this? And then you repeat, yes, I give you 2 milligrams, so that there are no misunderstandings. And they actually implemented this strategy also on the boat. They work with checklists, standard operating procedures. We're also inspired by medicine. We designed some checklists with them. I did some classical risk management strategies. So we actually visualized everything that could go wrong. So we created a what if list. What will they do if this happens? So if someone gets sick, if someone's overboard, and we actually created all these scenarios. And this was inspired by a study also we did in Antarctica, where people said, hey, we need to have a plan A, B, C, D, because things always go wrong. And so we try to prepare them for all possible things that go wrong. And also one strategy that we implemented is like a morning effect check-in, because these 4 are very ambitious athletes, which leads to some tense interactions, if I can say, like shouting. And so, yeah, they're very ambitious, which is good. That's why they are there where they are. But also for the interactions on the boat, sometimes, yeah, they're just fighting. And that's, of course, when you're together on this small boat for a month, it's very critical. So they get up and then they inform how they feel on a scale from 1 to 10. 10 is great, 1 is very bad. And they know, okay, this person is maybe today a little bit grumpy, and then they can actually adapt depending on what rating you have during the days. We're still working on some maybe intervention. So if everyone feels bad, they're not there yet. But I think that's what they're working on now, with this at least voicing how they feel a little bit, so that maybe you are a bit more careful what you say if someone is really on a bad mood, and that they have these standard check-ins every day. So I talked about the number of processes, states, strategies in these extreme environments. So in the beginning with the medical teams, mainly about team reflexivity, debriefings, or short timeouts that you could implement in your team. Then we talked about regulating emotions, learning from these Antarctica teams, how team cohesion in isolation actually decreases conflicts, and how social networks could be a method to actually monitor these team dynamics. And at the end, the example with the rowing team. And yeah, I hope you enjoyed this ride into the world of these extreme teams. And I also hope that maybe you're taking away an idea or two, maybe also for your own team to strengthen the well-being and maybe also the performance in your teams. Thank you very much.
Yeah, thank you very much. It was really great to listen to all of your study results. And yes, I'm, with this clapping, as people enjoying it. And really, congratulations. I believe that you're very insightful. So I really like the picture you gave to us. And I really like the connection that you combined these few types of studies. And I really appreciate introduction, the vision of extremity, because we often speak at use the term extreme environments, but there are different types of being extreme, so extreme environments and extreme tasks. So I really, really like that and appreciate that. But I can, I could possibly ask you dozens of questions now because this is my field of study, but please, everybody, the floor is yours. And now's the time for you. And now Jan has a couple of minutes for us. So please, if anybody has any question, that's the time for you. I encourage, because as I told, I can ask thousands of them. Monica, please. Thank you. Oh, nice to have you here.
Hello, everyone. I don't know if Jan is going to hate me for asking questions as his team member. But I actually took an opportunity. There was no questions yet. And I was wondering about this extremeness continuum that you designed in you and your colleague, Jan. Because we work with this continuum all the time as our team. But when we were in Antarctica with Andres this season, we were actually thinking about the other dimensions potentially of extremeness. And I was wondering what you think about that. For example, summer versus winter in Antarctica is very different. And like we discussed before, maybe the summer is not so extreme. So it is still to some extent extreme, but it feels sometimes like the risks or life-threatening situations are less likely to happen even than in the real life. So you're more likely to be driven over by a car in the city than, be killed by a seal in Antarctica in the summer. But if something happens, then you're stuck and you don't have access to hospitals or evacuation, right? Whereas in the city, you can immediately be taken to the hospital. So there is something about the risk or like maybe the likelihood of something happening, and then also like how extreme the consequences are. So maybe, for example, or the same thing with car, driving a car or going somewhere by plane, that people die more often in car rides, but then when, or when they are hit by a car or something happens in the car, maybe it's not as extreme, whereas in the plane crash, you basically die immediately. So do you think there is a place for that in your model, or if there is yet another model or something? I don't know. What do you think of that?
Yeah, I mean, like these models are always some kind of simplification of the real world, right? And it's never perfect. And we worked on this for 2-3 years, and we thought about 2 dimensions, 3 dimensions, which makes it already a bit complex. And you also need to be a bit having this view that we want to use it at one point. And if you have like 3 or 4 dimensions, it's kind of difficult then in the literature, but also in reality to use it. I think the basic idea is the more extreme something or the environment is, the more likely it is that an extreme event happens. Of course, in a low extreme environment, I can also, get hit by a car, and it's not that extreme, but still it can happen, right? But the higher on the level of extremeness you are, then the more likely it is that you actually experience these events, and you need to prepare for them. If you go rowing over the Atlantic, you're most likely be tired or be injured. So it's very high likelihood that this happens. And then the magnitude, what you were saying, so of one event, of course, one event can have very high impact, low impact, and then we're more in the classical risk management where you have the frequency, how often or how likely something is happening, how big is the impact, which multiplies. If something is a very high impact, then you probably need to invest or prepare for it. But if it's medium impact and very not really likely, then maybe it doesn't make sense to invest too much because it's not that likely. And also the impact, maybe we won't die. I mean, you can put that into these extreme continuums, the environment. If it's something, if the impact is higher, then we can argue the extremeness is also higher up. That will be very, very complicated, specific calculations. It's more, like a general framework to put things, categorize things, and also actually to make parallels between different literature streams. That was the original idea, right? You can think, okay, yes, we have these extreme high isolation, high environment extremeness, and in this we also have this. So then let's learn from the ones who are in the same sector. And the one high can maybe learn one aspect from these and one aspect from the emergency team. So really just to connect the different contexts and also literature streams that are often very scattered in different journals and fields.
Mm-hmm.
But it's never perfect. Yeah.
Or we can write another study to add more dimensions, make it more complicated.
Yes.
Okay, thank you.
That was a great question also, Monika. And so if I may make a comment, so there is also an aspect of probability per capita, because the fewer people are gathered in Antarctic polar stations, for example, then all over the world crossing, streets and being probably hit by car. So this is the great topic and very, very important. But please, do you have another question? Is there another question? Oh, Marcin, please.
Okay, hello everyone. In the beginning, you've said that in a high impact situation, personality doesn't make that much of a difference when it comes to motivation, and I understand to behavior exhibited later. And I was wondering whether such situation is trained for, like you've said, with all those plan A, plan B, plan C situations, or if a situation is really unprecedented or random. Does it make a difference? Is there a difference between these types of situation, high impact situations?
Mm-hmm. Mm-hmm. So yes, so the idea is, so the more pressure in the environment or something, or stress, so we're probably quite bad in improvising just on the go if we don't have a lot of resources. That's why this idea of this contingency planning. So if you have things, even if it's just went through mentally a certain situation, then the stress is a bit lower and you can probably deal it better. If you come in a completely new situation, that doesn't mean that we're not able to handle this, and this happens all the time, right? You can never anticipate everything, and that's then something where the team comes in. And I think when you have good team processes, on one side I talked about the backup behavior, so if we're then more in the team resilience field. Right, so a team is resilient if they can deal with adversity, bounce back. And resilience means basically, on one side, you have good team processes, you support each other, or maybe if one team member is very stressed, is in a very high pressure, and cannot think anymore, then that's the moment where the team actually steps in, or a leader gives some guidance and calm down the team member, and then they can discuss, and maybe even the team reflexivity might be an intervention that something that I have in mind in this environment. So to have these very brief, okay, stop, let's reflect, what's going on here? We're stranded on this island. What do we do now? Some ideas. That's where the team comes in. And if you have a good functioning team that can interact, build on each other's ideas, and have good decision making, basically, that makes the team more resilient and then better. But that also needs some kind of a good team climate, psychological safety, so that everyone actually feels safe to reflect and talk to each other and build on each other. Yeah.
Okay, thank you very much.
Thank you. And do we have another question? I really encourage everybody to ask the question and use this great opportunity. But as Martin asked you a question, I will follow up, because Martin is in our team Mental Health. He is also my master student, but also involved in the project. And I was really wondering about our study results in comparison to what you show, Jan. You showed these graphs. It was study 3, I guess, which you showed. So study in Antarctic and the emotional fluctuations. Yeah, if you remember. And it was a great. It was very good to hear that there is emotional contagious. Yeah. So, for example, the people share somehow the emotional fluctuations. But we and as if I understand correctly, the emotions were measured by PANAS scale. Yes.
Yeah.
So, and this is something which we are now exploring, because we add this Noldus face reader application. So we are now also analyzing the facial expression of emotions. And unfortunately, when we are using the software, we don't have this, the emotions of team members do not collapse. So they are not in the same schema. And this is fascinating for me, and maybe you've got some answers here. Have you observed this emotional congruency, so the same pattern followed by everybody, because you only used example of 2 team members, or were there outcasters? Because in our study we've got problem that some of people are, following the schema, but we've got, people with ups and downs of emotional fluctuation. And the question is whether they are some kind of outcasts, or it is how it is. So we always would have people experiencing differently these very unique environments.
Yeah, I think so. Our study in this regard is probably quite limited, because it was just one team, and also a team with only 2 people, right? So there was much more interaction, or the interaction is mainly between these 2. It's almost like a couple, right? Where, of course, there also you have this contagion. There's a big literature about crossover effect, spillover effect from work to home, and conflict at home influencing you at work. If you have 3 or 4 people, the interactions are less. Maybe these 2 interact and the other 2, but not you know what I mean? So they're never completely balanced, right? So I would expect actually in bigger teams also less congruency without having measured that, right? So I think that's probably the effect, because it is just one couple basically that work together very intensely on the same project. And if you have 3 or 4, then. But still, there might be, what you could do is look at the extremes as we did, right? Because the extremes should be more salient and impact all of them. And then maybe the others a bit less. And there, of course, is also individual differences how we deal with emotions, right? Some are very good in regulating per se, others a bit less. Some are very expressive, others are not. And then also the ties between the team members, how empathic I am. If I'm more empathic, then I probably are also more influenced. If someone is a sociopath, won't be influenced at all by my team members' emotions, right? So that's also a spectrum that you might be able to control, even for like some kind of trait empathy. Yeah.
But that's a really interesting aspect, because also, all our literature on emotions in isolation or emotions in extreme environment is based on some kind of averages. And, what we know so far, these are little samples. I really appreciate the differences. I don't know if our meeting participants paid attention to that, because the first study you had, great samples, like, wow, enormous, like over 2,000 participants. Wow, yeah. So it was great. It's like 70 teams. And after that, we are coming to these extreme environments, and we've got 5, 8 people, 2 people, 4 people rowing, and that is how it is, and we are dealing with that. But when we are measuring, the span of emotions, for example, in this 8-month time, in 5 people team, and we are making averages, for example. So one person not able to regulate his or her emotions perfectly will affect greatly on conclusions of the emotional fluctuation. And this is something I'm really interested in, how to cope with this also methodological problem, and how to come to useful conclusions, because you also made a great point that we are, as you are working with this rowing team, we are making some interventions, we are preparing some support, so psychological support for those people. So we must really have a data we can really rely on. So that's why I found also your work extra important.
Thank you. And I think to that, even our Concordia data, where I showed the nice graphs, all cohesion goes down, conflict goes up. If you look at the signal responses, they're all over the place, right? These are really just means, or for example, paranoia, loneliness. There are people who are super high, others are very low. There are a lot of inter-individual differences, and that obviously make difference with 12 people, right? So we actually excluded the extreme outliers. We had to, otherwise, it just pulls everything up. So we need to be very careful with just looking at the means and individual experience. And that's why I think the network approach could be very promising, because then you have the whole team, and you have always the dyads, this and this and this and this. For example, cohesion is like this team construct. And then we assume that everyone in the team has the same view of the cohesion, which is not true. Same with psychological safety, for example. There is always variability how I perceive the team climate. So with a network, then I really, me and Thomas, I feel this, and me and the other person maybe less, and then you get the whole network, and you have these. It's much more nuanced and probably presents the reality much better. Also much more complex to handle methodologically.
I totally agree with you, so thank you very much. Do we have any other question? If not, it was really a great honor to have you here, and for me, very inspiring talk, also from the perspective of studies which we are running. And I also do hope that you and Monika would have a possibility to run the studies in our instrumental health project. And also, I believe that those badges would be very useful if you are interested in, measuring these two teams' dynamic interaction, because we will have isolated team and joining in the middle, different team for shorter isolation. So maybe it would change also the dynamic and the perception of. Because I really liked in your Concordia studies the sense of being less conflicted with our own nationality team members. But still, whether the nationality was factor or different factors were important to create this click or intergroup. So I hope that we will have possibility to collaborate on that also. And really, thank you for virtual visit at our university. Thank you in the name of our internationalization team of University of Silesia Institute of Psychology. Great to have you here.